Proprioceptive neuromuscular facilitation, PNF, is a therapeutic exercise technique used to improve muscle strength, flexibility, and coordination. It often involves a combination of stretching and contracting muscles to enhance neuromuscular function. These techniques leverage the complex interactions between spinal circuits and the central nervous system, which can be significantly altered following conditions such as spinal cord injuries. The role of neuromodulators like serotonin and noradrenaline in adjusting neuronal excitability is critical, as it influences muscle tone and motor responses essential for rehabilitation and athletic performance. Each technique, rooted in principles such as post-isometric relaxation and reciprocal inhibition, serves to promote muscle relaxation, enhance joint mobility, and facilitate neuromuscular re-education. The effectiveness of these techniques is supported by numerous studies, which highlight their benefits in pain management, recovery from athletic injuries, and overall functional improvement. Despite their notable applications, there are inherent controversies and limitations surrounding these methods. Critiques often focus on the variability of results across different patient populations, the need for more robust research methodologies, and the importance of individualized treatment protocols to accommodate diverse physical responses and conditions. The integration of these neuromuscular techniques into clinical practice not only supports rehabilitation goals, but also emphasizes the interconnectedness of muscle function and neurological health. By understanding the underlying mechanisms and applications of these techniques, healthcare professionals can enhance patient outcomes, optimize movement patterns, and foster long-term wellness strategies in their practices. Post-isometric relaxation is a frequently utilized mechanism involving a reduction in muscle tone following an isometric contraction. This is achieved by engaging the patient in an isometric contraction against a counterforce provided by the therapist, followed by a period of relaxation, which is typically between 5 to 10 seconds. This approach is believed to facilitate a decrease in tension within the targeted muscle, aiding in pain relief and improved range of motion. Reciprocal inhibition is another essential principle underlying PNF techniques. The reciprocal inhibition involves the isometric contraction of an agonist muscle, which subsequently leads to the relaxation of the antagonist muscle. By reducing the tone of the antagonist through this inhibition, practitioners can enhance the effectiveness of stretching and mobilization techniques. It is particularly effective in situations where muscle tightness restricts movement. The hold-relax technique is a specific application of PNF where the patient is instructed to hold a stretch at the end of their available range while resisting the therapist's gentle force. After maintaining this position for a specified duration, the patient relaxes, allowing the therapist to passively move the limb into a deeper stretch. In the contract-relax method, the patient performs a maximal isometric contraction of the muscle being stretched, followed by a relaxation phase. This technique aims to utilize the principles of post-isometric relaxation to enhance the effectiveness of subsequent stretching efforts. The hold-relax active movement technique combines the principles of hold-relax with active movement. After the initial stretch and relaxation, the patient is encouraged to actively move the limb into the new range of motion, thereby promoting neuromuscular re-education and functional mobility. Slow reversal involves a rhythmic alternating pattern of contraction between antagonist muscle groups, promoting balance and coordination. The slow reversal hold variant incorporates a hold phase at the end of each contraction, which can enhance stability and strength in the targeted muscle groups. Rhythmic stabilization focuses on promoting co-contraction and stability around a joint through alternating isometric contractions of opposing muscle groups. This technique is beneficial for enhancing proprioceptive feedback and improving postural control. Rhythmic initiation involves a gradual introduction of movement patterns to help facilitate motor learning and neuromuscular control. This technique is particularly useful in rehabilitative settings for patients recovering from injuries or neurological impairments, allowing for the development of coordinated movement patterns.